Hey there, ready to dive in? Today we're looking at health literacy, and we've got a really interesting article here, The Importance of Health Literacy in 2024. Now it makes you wonder, have you ever felt like you needed a translator at the doctor's office?
It's more common than you might think.
Right. One minute you're searching symptoms online, the next you're staring at a pamphlet on, well, whatever your diagnosis is. And get this article says only 12% of adults in the U.S. are proficient in health literacy.
12%! Wow! That really highlights the scope of this issue. It goes beyond just medical jargon.
It really does. And the article talks about how socioeconomic factors play a role. Education, income, even access to health care.
Yeah, it connects those dots and shows how these factors intertwine with health literacy.
It's like a web.
Yeah.
And it makes you realize that health literacy is about so much more than just understanding medical terms.
Exactly, and the article points out that lower health literacy often goes hand in hand with poorer health outcomes. Like if you don't understand your treatment plan, managing a chronic condition becomes even harder.
That makes sense. And it's not just individual health, right? The article mentions the impact on healthcare costs as a whole.
Absolutely. When people can't understand their health information, they might delay seeking care or end up in the ER more often.
And that puts a strain on the whole system.
Exactly.
And we can't forget the digital age. The article really emphasizes the growing importance of digital health literacy.
Oh, absolutely. It's not just about reading those complicated medical bills online anymore.
Right. We're talking telehealth, managing your health records online, even just sorting through all the health information and misinformation on the internet.
It's a whole other world, and navigating it requires a different set of skills.
It really does. Scheduling appointments online, understanding dosage info from an app, knowing what sources to trust, that's all digital health literacy.
And just like with traditional health literacy, there are disparities in access to technology and digital skills that come into play.
It's not always as simple as Google it.
Exactly. Imagine an older adult who's not comfortable with smartphones, or someone in a rural area with limited internet. Those are real barriers.
So understanding what health literacy really is, that's crucial.
I agree, and I think this article does a really good job of breaking it all down.
It's more than just reading pamphlets or knowing medical jargon.
It's bigger than that.
It's about being able to navigate the healthcare system and, most importantly, participating in your own health journey.
It's about having the skills to find good information, communicate your needs clearly, and advocate for yourself.
Be your own advocate. And speaking of advocating, the article talks about something called peachback. Have you heard of that?
Oh, teach back, yes. It's a simple but powerful concept.
It's where you explain the information back to your doctor, right?
Right.
To make sure you've got it.
It empowers patients to take control of their understanding. You're not just nodding along, you're engaging with the information.
It's like saying, hold on, let me make sure I've got this straight. It's so important. I like how the article suggests some questions patients can ask.
Oh yeah, like what?
Like, what are the side effects of this medication? Or how will I know if it's working? Those are good to know.
It's like having a cheat sheet for your appointment.
Exactly. And speaking of making things clear, the article talks about how important it is for healthcare providers to communicate effectively.
Oh, 100%.
It shouldn't feel like you're trying to crack a code.
Definitely not. Clear communication is key, and the article talks about using plain language, ditching the jargon, really taking the time to explain things clearly.
Meeting people where they are.
Yeah.
Right? Everyone's coming in with different levels of understanding.
And different learning styles, different backgrounds. Totally. And it's not just about language. The article even mentions cultural competency.
Oh, that's a good point.
Different cultures have different beliefs about health and illness, and healthcare providers need to be sensitive to that.
It's about trust, building that rapport.
Exactly. When you feel comfortable with your doctor, you're more likely to open up, ask questions, advocate for yourself.
Which is so important. But it made me think, as much as we're talking about what doctors should be doing, what about our own responsibility?
Right, it's a two-way street.
We want them to communicate clearly, but we also have to be proactive, right?
Yep.
Engaged in our own healthcare.
Exactly. It's about being an active participant, not just a passive recipient.
So how do we do that?
Well, the article suggests doing your research,
Okay.
but from reputable sources like government websites, trusted medical organizations.
Right, because not everything on the internet is accurate, that's for sure.
Exactly. You have to be careful, do your fact-checking, especially when it comes to your health.
And don't be afraid to ask your doctor for a second opinion or to clarify something.
Absolutely. Remember, you are your own best advocate.
So we've talked about individual responsibility, But the article also highlights the role communities play.
Oh yeah, community initiatives are huge.
It mentions the New York Public Library's health literacy program. They offer free workshops.
Wow, that's fantastic.
I know, right? They teach people how to evaluate online health information and navigate local resources.
That's amazing.
And it's not just libraries. The article mentions community health centers, faith-based organizations, even workplaces.
It's about meeting people where they are and providing support within those communities.
And that made me think about something we talked about earlier, the digital divide.
Oh, right. Because technology is a great tool, but not everyone has equal access.
Exactly. And that's where those community programs are so important.
They can offer digital literacy training, provide free computer access, help people navigate telehealth.
There are some great initiatives already out there, but it makes you wonder, what else can we do? How do we take this information and empower even more people?
That's the million-dollar question, and I think it starts with recognizing that health literacy is everyone's responsibility.
It's not just on individuals or doctors or communities.
It's about all of us working together to make a difference.
It's a team effort, for sure. We all want to be healthy, and knowing how to navigate the healthcare system is a big part of that.
Huge. And this article ends on a really interesting note. It's not just about having the information, it's about what you do with it.
It's about taking that information and making the best decisions for your own health.
Exactly. You're in the driver's seat.
I like that.
You're not just along for the ride, you're actively participating. You're gathering the information, making choices, working with your doctor, being an active CEO of your own health.
That's a great way to put it. So to wrap things up,
Yeah.
what are some key takeaways from this deep dive on health literacy?
Well, first, we learned that it's a much bigger issue than many people realize. Only 12% of adults are proficient. That's a really small number.
It is, and it makes you realize how important it is to understand what health literacy really means. It's not just reading and writing, it's about navigating the system, advocating for yourself, being proactive.
Being your own best advocate. And we talked about some ways to do that, asking questions, seeking out reliable information, and of course, using that teach back method.
Which is so simple but so powerful. And let's not forget about those community resources, libraries, health centers. They're doing amazing work to bridge the gap.
Absolutely. It's a community effort, and it's about all of us doing our part to create a culture of health literacy.
Well said. This has been a really insightful deep dive. It's amazing how much we learned from just one article.
It really shows you how relevant this topic is to all of us.
It really does. So to our listener out there, we hope you feel empowered to take charge of your own health. Keep asking questions, keep learning, and keep those conversations going.
Absolutely. Knowledge is power, especially when it comes to your health. And remember, you're not alone on this journey. There's a whole community out there to support you.
Couldn't agree more. Thanks for joining us for this deep dive, and we'll catch you next time for another fascinating discussion.